Hi, everyone. Thank you for joining our webinar today. We will be discussing fertility and all things about cycle regularity. I'm Emily Guilfoy. I am a chiropractor and acupuncturist. I've been in practice about 6 years, and I just have an extreme passion for helping women in this perinatal period.
Hi, everyone. I'm Katie Chambers. I'm a physician assistant. I did my training at Butler University in Indianapolis. I've been practicing for about 10 years now. And just like Emily, I have an extreme passion for helping women during this prenatal and perinatal period.
We're going to go ahead and dive into our seminar today. We'll all be discussing fertility and really this roadmap to success. And as we kind of go through this journey together today, we really just want you to stay really well focused on the information and feeling empowered that you can make some positive changes to your daily routine and your lifestyle to really impact your fertility in the best way possible. We know that this information, when you're really kind of getting started, can be a little bit overwhelming, but we really hope that you feel inspired and empowered going forward from here.
Okay, so as we dive in, I think it's important to understand where we stand from a global perspective on who is affected by infertility. So 1 in 6 people of reproductive age are impacted by infertility globally. 1/3 of that infertility is caused by female factor, 1/3 of that infertility is caused by male factor, and 1/3 of that infertility is a combined female and male factor. For those individuals who are trying to conceive, about 85% of healthy couples will conceive within 1 year. And with that in mind, if you are someone or a couple who are younger than the age of 35 and you've been trying to conceive for at least 12 months, or if you're over 35 and been trying to conceive within 6 months and have been unsuccessful, that's when we really recommend that you start to seek reproductive health care and see your care provider to find out what's been stopping you from being able to be successful. One of the first things we think about before we start even trying to get pregnant is stopping our birth control or our contraception. You can see here different time frames of when you want to stop your contraception based off of what you're either taking or what device you're using. These are minimums of when you should stop your contraception, with the thought that if you started contraception like an oral birth control pill or an IUD because you were having painful periods, irregular periods, maybe for acne or PMS, that you give yourself more than these minimum times for your body to reestablish its natural cycles and get back into its natural rhythm of your reproductive hormones so that you have time to understand if you're having any abnormalities in your cycle, if you're having difficulty ovulating. So example, the minimum time to stop your oral contraceptive pills before you want to become pregnant would be 3 to 6 months. But if you started them 5, 6 years ago because you were having irregular periods or very painful periods, I'd say stop them as soon as you can, like even a year or 2 years beforehand, to give your body that time to readjust to its natural cycles and identify any problem areas that you might be experiencing. One of the other things you want to consider is that if you are an individual on oral contraceptive pills, those birth control pills, that they can have some nutrient depletions that occur over time. So these are things that you don't necessarily have to have tested, although you can, but things you want to start thinking about when you want to start trying to conceive, to make sure that you're consuming adequate amounts of food and nutrients that have things like folate, magnesium, your B vitamins, because these are all very important things for fetal development and pregnancy, and we want to make sure they're at adequate levels before you even get pregnant. So just things to start thinking about before you even start the process. Other things to start thinking about around the same time you're stopping your birth control is exercise, stress, and overall nutrition. And these are all things that we're going to dive into today.
So before we get too far, we want to just take a moment to really take a good look at our female reproductive cycle and really understand it well as we go through the rest of this discussion. So the first thing I want you to pay attention to is what's happening on the bottom of this image. So you're going to see day 0 to day 14 to day 28. And we consider day 1 the first day of our menstrual bleed. We go through what's then called our follicular phase of our cycle. We reach day 14. This is when ovulation occurs, when the egg is released from the ovary. And then we move through the second phase of our cycle, which is called the luteal phase. This is when the endometrium gets really good and thick to prepare for either implantation of an embryo or to then start our next menstrual cycle. So then on the bottom of the screen, you also see day 28, which is the end of this cycle. And what you could, in theory, then say day 29 is our new day 1. We would start our menstrual bleed, and it would be the next cycle. So again, first half of our cycle is the follicular phase. The latter half of the cycle is the luteal phase, and they're demarcated in the center by ovulation. We have a lot of hormones that are at play here, but they're really pretty simple when we start to tackle them. So you're going to see anterior pituitary hormones as well as ovarian hormones, and you're going to see both of those on your screen. And the green line is going to be our follicle stimulating hormone. So this is the hormone that starts to increase, that starts to tell our ovaries to produce a mature follicle or a mature egg. As that begins to develop, that egg begins to develop, that follicle develops, our ovaries secrete estrogen. And you can see that as the orange line. And that orange line, gets taller and taller, the estrogen builds. And then that signals to our brain, back to the anterior pituitary, to release the blue line, the luteinizing hormone. And that luteinizing hormone, that big surge, that big peak you see, triggers ovulation. And luteinizing hormone is going to surge roughly 24 hours prior to that egg actually being released from the ovary. So once that egg is released, you see a very sharp decrease in your follicle stimulating hormone, your luteinizing hormone, as well as your estrogen. And you see something called progesterone really start to build in the second half of the cycle. It's been pretty quiet for the first half of our cycle. So that's that purple line. So progesterone is builds, and that helps to thicken that endometrial lining. You're also going to see a little bit of a peak of estrogen as well during that time. They're both going to kind of build to create a healthy lining. And then finally, progesterone and estrogen die off or start to fall off, and then we start our menstrual bleed again. And so the top of the screen, you're going to see what's happening in the ovary itself. And it's worth noting with all of this information that, this is just kind of a generic cycle that's being presented to you. Really, a healthy cycle, an average cycle, is actually a total of 29 days, and anywhere from 24 to 35 can really be considered healthy. Likewise, an average period length is 5 days, and a healthy range can be anywhere from 3 to 7 days. And then an average ovulation day is actually day 15 for most women, but a healthy range can be anywhere from day 10 to day 23. So when we're diving in now to cycle tracking, there's kind of this idea called fertility awareness method, and it really involves 3 different types of tools for tracking. So the first is going to be cervical mucus, or tracking that. The second is cervical position, and then the third is the basal body temperature, or the BBT you see here. And just I'll take a few minutes to talk about cervical mucus and cervical position before we dive into this. But with cervical mucus, really what we're tracking is really the quality of the mucus. And what tends to happen is that after we've finished our menstrual bleed, we may see a few days of what we call just dry cervical fluid. We don't notice really anything. As we approach ovulation, we should start to see maybe more of a sticky quality in cervical mucus, maybe developing more into a lotion kind of consistency. And then as we are very much near ovulation, we should see like an egg white consistency in our cervical mucus. And then following ovulation, all of that cervical mucus very quickly dries up. So that's a great way to track when ovulation is occurring in our bodies. And that cervical mucus really creates a good, healthy environment for sperm to survive, to create and achieve conception. With cervical position, what we're going to notice as we approach ovulation is that the cervix actually lifts up higher into the body, and the opening, or the os of the cervix, opens up ever so slightly to help to achieve conception. Otherwise, cervical position is quite frankly pretty unexciting through the majority of your cycle until those few days right around ovulation. So we want to use those 2 signs along with basal body temperature to really get a good picture of when ovulation is occurring. Now, basal body temperature is very easy. There's just a special type of thermometer you purchase, and you take your temperature. most of the time under your tongue, first thing in the morning upon waking, before you take a drink of water, before you get out of bed, do anything else. And you chart that either on a paper chart, or now we have lots of apps that will do it for us. And what you're going to see here, so you have a good picture on your screen of what's happening in the temperature of this person. So in our follicular phase, that first half of our cycle, we have lower body temperatures that are maybe around 97.4, 97 degrees Fahrenheit. And then following ovulation, honestly, like the day after ovulation, we will really see a big spike in temperature that might be about a half a degree to a full degree. And then you'll see that sustained through the end of your cycle until either, like on this graph, there's a pregnancy achieved, or whenever your next menstrual bleed begins, the temperature will fall back down. This can be a great tool because it will confirm that ovulation has occurred. However, you will be looking for 3 consecutive days of elevated temperatures compared to the previous 6. So this is a lot of like verbiage here, but it's really necessary to confirm that ovulation has occurred. Now, if you've waited your 3 days and you've confirmed it, the tricky bit of this is that the egg is really only viable for about 24 hours to achieve a pregnancy. So by the time you've waited your 3 days, if you are actively trying to conceive, you've kind of missed your window if you're looking for that 3-day mark. So it's best to really be tracking cervical mucus and cervical position to plan sex accordingly to achieve a pregnancy. Now, on the flip side of that, if you're using this to avoid a pregnancy, it's fantastic because you can get your 3 consecutive days, feel very confident that you've ovulated and that you are no longer kind of have a possibility of becoming pregnant, and you're good to go for the rest of your cycle. With this, there's a few other limitations in that it is very, very easily impacted by sleep disturbances. So if you're getting woken up at night very frequently, it's going to be potentially a little wonky, or you might get some like more aberrant readings. And then likewise with fever, of course, your temperature is going to be elevated. And then alcohol consumption will also cause elevated temperatures. So we talked about those 3 kind of aspects of cycle tracking, primary aspects of cycle tracking. And I like to say that LH testing, or luteinizing hormone testing, is kind of a great like secondary factor to help confirm that ovulation is occurring. And so again, luteinizing hormone is going to peak about 24 hours prior to ovulation. And this is a really easy test. These are test strips that you can do at home. It's a urine test. So you're getting your results within maybe like 5 minutes to confirm that ovulation is indeed occurring. Now, just like with basal body temperature, there are some limitations with this, in that people who have PCOS are very like long, irregular cycles. This can be a little bit more challenging to actively track.
Okay, so along with those ways that Emily described for tracking your cycles, there is another, or a couple different devices that they've come out with recently that are digital fertility monitors. One of those is called a Mira device, and another one is an Anito. Today I'm going to tell you about the Mira device because it's the one that we use and we really like it. But these are really cool because they track your metabolites of your urine hormones. So it's going to track all of the hormones, not just your LH, so your progesterone, your LH, and your estrogen. And it gives you a whole cycle picture. So not just tracking or catching that LH surge or that ovulation, but also catching maybe dysfunction in your estrogen or your progesterone, or the whole picture. It still predicts an ovulatory window, and it still works like an LH strip. So you urinate on it at a specific time, you insert it into this device, and then it attaches to an app on your phone and gives you a whole picture, which I'm going to show you what that looks like. And it's as accurate as doing a blood test, which is really cool. So let's see. I'm going to show you what a typical cycle map would look like using a Mira device. So this would be a normal cycle, and this is testing almost every day. With the device, you don't always test every day. They'll tell you, you put in what your goals are with using it, whether that be like fertility, regular cycles, just learning about your cycle, and it'll tell you how often to test. But this is an example of testing almost every day. So you can see here it tracks the LH, which is the blue line, the estrogen metabolite, which is the black line, and then the progesterone metabolite, which is the purple line. And you can see here that this is totally normal, kind of if you think back to that first graph that Emily talked about, where during your follicular cycle, your estrogen slowly builds. It peaks right before your LH surge. Your LH surge occurs, sometime around day 15 of your cycle, 14 or 15. After that, the LH drops off, the estrogen drops off, and then you can see the purple line of the progesterone rise and fall during the luteal phase. And you also have that secondary estrogen peak during your luteal phase too. So that's what a normal expected cycle would look like using this kind of monitoring. This is an example of an irregular one. This is only showing the LH and the estrogen here. And you can see here with the estrogen there, you don't see that normal gradual rise and then peak and fall of the estrogen, and you don't see that LH spike indicating ovulation. So there's no ovulation in this patient. This could indicate PCOS, ovarian cysts, other irregularities. And if you're seeing this, then it's something you want to see your care provider about to learn what's going on and how to fix it. This is another example. This does have all three of the hormone metabolites on it. You can see that there is that gradual rise of estrogen with the black line. You can see the blue line has that LH surge, and then the progesterone starts to increase. You can see here that on day 19, this individual got their period, and that caused them to have a short luteal phase, only a 7-day phase, which is short. And that can be problematic when trying to conceive, because if you don't have a long enough luteal phase, then you're not going to have enough progesterone, which can cause problems with implantation and other things. So if you're seeing something like this, again, a reason to see your care provider to understand what's going on. Okay, so we talked about lots of things in terms of like tracking your cycles and preparing to become pregnant. Now we're going to dive into lifestyle factors, and we're going to start with the thing that most people don't like to talk about, which is weight. And more specifically, when it comes to weight, we're going to talk about metabolic health, but we're going to touch on weight just to begin with. So I think most of us are aware that being overweight or underweight can affect our reproductive health. Some women who are severely underweight don't have periods at all and are not ovulating. Same thing with overweight individuals. They have irregular cycles, irregular ovulation, and sometimes aren't ovulating, which obviously can make becoming pregnant difficult. We also know that being overweight increases your risk factors when you do become pregnant for things like gestational diabetes, preeclampsia, gestational hypertension, those types of things. So we want to be a healthy weight when we're trying to conceive. But more importantly than just the number on the scale is your metabolic health. And when I say metabolic health, I'm referring to things like your blood sugar, your blood pressure, your cholesterol, your visceral abdominal fat, which is the fat that's in and around your core that puts you at higher risk for things like diabetes and heart disease. Those are all things we want to optimize while we're trying to get pregnant to increase our chances in our health. Specifically with fertility, we think about your glucose levels and insulin levels. Having high glucose levels and high insulin levels have a direct impact on your egg quality and your reproductive hormones. High insulin levels specifically can have an impact on your estrogen and can cause dysfunction in ovulation, obviously making it difficult to track cycles and become pregnant if you're not ovulating regularly. High glucose levels can impact your mitochondrial health. So just a reminder, your mitochondria are those little power plants in all of our cells. And this is really important when it comes to egg development. If you don't have proper mitochondrial health or you have dysfunction in your mitochondria, it can cause your chromosomes during development to not separate properly, which can cause genetically abnormal eggs and potentially genetically abnormal embryos, which can affect your pregnancy outcomes. High glucose levels also create advanced glycosylation end products, or AGEs. These AGEs are well known to cause cosmetic and cardiovascular aging, and new studies have shown that they're also linked to ovarian aging and ovarian health, essentially. So they can impact your egg quality if you have higher levels of these things. So it's important to keep your glucose levels stable. There's even a study that's been shown that women who go through IVF who have higher levels than average of these AGEs have fewer eggs retrieved during IVF, fewer eggs fertilized, fewer good quality embryos, and overall lower pregnancy rates. So, how do we optimize our metabolic health and most specifically our blood sugar levels and our insulin levels? Some simpler things kind of to touch point on the bottom of the list here is to optimize our lipids, optimize our blood pressure, exercise regularly, and reduce that visceral abdominal fat, that fat that's in and around our core. We're gonna talk about nutrition and exercise, so we'll touch on those a little bit later. But specifically, I want to talk about what we call our glucose hacks. So these are things that are going to help regulate your blood sugar in a way that keeps your blood sugar more stable. Every time we eat, our blood sugar is going to rise and fall depending on what we eat. However, we want to avoid having high blood sugar spikes and falls throughout the day because that generally increases our insulin levels and over time increases our average glucose levels as well. We can do that by first focusing on slow versus fast carbs. So we want our complex carbs versus our simple carbs. And Emily's going to kind of talk about that a little bit more when we get into nutrition. But we can also do things like eat our food in a specific order. If you start your meals with vegetables, then eat your protein, then eat your fat and your carbs, it can actually help keep your blood sugar more stable and avoid those blood sugar spikes, which help keep your insulin level more regulated as well. Other things that also do this and help keep your blood sugar more steady or regulated is going for a walk after a meal, adding apple cider vinegar to salad dressings, or if you're someone who likes to drink it with some water, doing that as well. Starting your day with a savory breakfast instead of a sugary breakfast can make a big difference. So these are all things that you can start doing that don't really take a ton of time or investment that can make a big difference in your blood sugar. One of the tools I really like to use with patients is a continuous glucose monitor. You might have seen commercials for these, but they're little devices that kind of insert or stick on the back of your arm, and they attach to an app on your phone, and it does exactly what it says. It continuously monitors your blood sugar. And it's a really cool tool to see exactly how different foods affect your blood sugar, to see how stress affects your blood sugar, and how exercise and different things affect your blood sugar, and then tweaking your diet and your lifestyle to keep your blood sugar from spiking. So you can see how changing just the order that you're eating something can change your blood sugar from spiking and keeping it more stable. So those are pretty cool. Some of those devices do require a prescription, but you can get one through Stello, I believe, that is direct to consumer. And if you want to try that out, it's a really cool tool to use to optimize your health in this manner.
As we take this deep dive into diet, I'm going to be focusing on some macro counting. But truthfully, I really hope that you maybe do this for a few days, maybe a couple weeks, but then you start to see really what these portions look like, and you can kind of ditch the counting and just kind of eat intuitively. Generally speaking, our diet recommendation is going to be a Mediterranean-like diet. And I say like because I'm going to have you increase protein pretty drastically. Protein consumption, our goal, generally speaking, is about 100 grams of protein a day. And what you're going to see in front of you is obviously some different options. Really, truthfully, the quality of your protein really does matter. Certainly, if financial considerations are coming into play and those just aren't within your means, please just focus on getting the protein in. But if you have the capability, prioritizing grass-fed beef, even your grass-fed milk products, along with your pasture-raised eggs and pasture-raised poultry, are really helpful, as these are like anywhere from like about 30% higher in our vitamin A concentration, about 2 times higher in our vitamin E, anywhere from like 2 to 4 times higher in omega-3s, and about 3 to 6 times higher in vitamin D. So we know that our food, or the quality of our food, really does matter. And so focusing on those things can be really helpful. Likewise, when we're talking about kind of the concentration and like the bioavailability, I mentioned here kind of at the bottom of the screen, about 3 to 6 ounces of beef liver. And we're going to kind of flash forward to our next screen just to see why that's so important. So a few things to point out here. And you're going to see beef liver compared with beef heart, compared with ground beef. And one of the big things I want to point out is the concentration of vitamin A, B12, folate, and then choline. And you're going to see beef liver is incredibly dense in those nutrients. And those are all things that either birth controls can deplete and are things that are very necessary for good fetal development. So they're definitely resources and nutrients that we want to have very well replenished in our bodies before we even get pregnant. And beef liver tends to be something that is not really well sought out. So it tends to be a more affordable protein option. And you can really do a great job of cooking this and hiding it in things like tacos or hiding it in anything you would use ground beef in. So I'm a big proponent of adding in beef liver for nutrient density. Talking about fat now, this kind of recommendation, so 95 to 100 grams per day of fat is dense. This is about 40 to 45% of our calories, which as women, we are kind of historically under eating fat. And certainly there might be times in your life where this is helpful, but preparing for pregnancy is really not one of them. And the easiest way that we can kind of talk about this is really that estrogen and progesterone are both of our vital hormones for good menstrual cycles. And they are both derived from cholesterol. And cholesterol, we have to get that from fat. So you must be consuming fat to be able to build healthy hormones. We know that women, when they're consuming like full fat dairy, have higher LH levels and lower testosterone. So you can kind of think of testosterone kind of like estrogen in the female body. And so we want that, we don't want that excessive estrogen or that over dominance of it. So just to say that full fat dairy and consuming good fat products helps us to have a better hormone balance. And then when we're talking about carbohydrates, this is going to be much lower than what you're probably used to. So we're talking like 15 to 30% of our calories are coming from carbohydrates. And if you're somebody who's maybe dealing with PCOS or has some other insulin resistance issues, you might be aiming more on that lower end of the carbohydrate consumption just to keep blood sugars a little more regulated. But with this, we really want you to kind of focus again on like the complex carbohydrates. So things that are going to have a lower glycemic index and less impact on your blood sugar. So these are whole grains. This is oats. This is things like quinoa, like brown rice, beans, lentils, good starchy vegetables like sweet potato, parsnip, those things can be really pack a punch nutrient wise and then don't have such an impact on our blood sugar. Within this, there's lots of studies to really show that blood sugar regulation has a huge benefit to our menstrual cycle regularity as well as to our conception rates. But one that I find fascinating is one in which they compared a group of women consuming high carbohydrate diets, one consuming low carbohydrate diets, and just they didn't tell these women to do this, but the group that was low carbohydrate consuming diet actually had just higher rates of alcohol consumption. They smoked more, they drank more coffee, ate fewer vegetables, they were more sedentary. So they were doing all the things that we would kind of historically say are kind of like bad for your health. And yet they actually had better fertility factors than the group that was consuming high carbohydrate diet. And so that's just to illustrate not to necessarily do those poor lifestyle habits. Those are not good. But just to illustrate how impactful blood sugar and carbohydrate consumption can be for fertility. So some additional considerations when we're talking about diet. Obviously, we want to incorporate vegetables, and then we really want to do things that are beneficial to our digestive health and to our microbiome. So consuming things like bone broth can help actually seal our gut lining if we maybe have flirted with some leaky gut in our past. And then consuming foods that are fermented, like sauerkraut and kimchi, can help create a better microbiome. And we know that the gut dysbiosis can actually impact our estrogen metabolism. So getting that in balance can really help our hormones. And then likewise, consuming enough electrolytes or salt can also have a really big impact on our fertility. So we know women who are consuming less than 1,500 milligrams of salt have actually been shown to have almost a 40% lower progesterone level, as well as almost a 3 times greater risk of anovulation. So those things can be really impactful for menstrual cycle regularity and fertility. And then likewise, of course, we want you eating enough calories. And so again, as women, we kind of historically are under eating. And this is just really not the time. We know that restricting caloric intake by about 25% can be shown to disrupt our menstrual cycles, even just within a few months. And so then moving on to some things that we want to avoid that I think, again, like we all know these things, but it's important to hear it again and like in the context of fertility. So with alcohol, we know that alcohol will deplete our B vitamins. So if we're recovering from our oral birth control pills, we know that those have depleted B vitamins as well. So if we're adding alcohol to the mix, we're just compounding that factor. It's also going to disrupt our circadian rhythms, which we're going to talk about sleep in a little bit, and how helpful that is to our fertility. And likewise, it impacts detoxification. So it makes it more difficult for our body to actually metabolize hormones properly. And so with all of that, we know a single alcoholic drink will actually raise our estrogen levels by 5%. And we know 4 or more drinks will actually raise it by 60%, which is pretty darn significant when we're talking about really harmonizing our hormones. And then seed oils are another great thing to avoid, as these are very high in what's an inflammatory omega-6. And again, omega-3s, we want omega-6s cause inflammation. And this creates a higher need for vitamin E in our bodies to help kind of put out the fire. And vitamin E we already need to build a really good, healthy endometrial lining. So we really want to just prioritize that vitamin E for our endometrium and not have to use it to put out a fire. And then, of course, our refined sugars and flours, processed meats. And then lastly on the list is just to try to avoid those high pesticide residues foods. So this is things that have been used with Roundup or glyphosate. And we totally recognize that, like, again, financial limitations can sometimes limit our ability to purchase like all organic produce. But we really hope that you can use the environmental working group to prioritize eating the Clean 15. You can buy those potentially non-organically, and then to really prioritize eating the Dirty Dozen as organic. Or purchasing those as organic as possible. So moving into exercise and talking about our movement. And again, I think we all are very well aware of like the amazing benefits of exercise. But we have some really awesome parameters when it comes to fertility. So we're looking at mild to moderate exercise, 5 hours or less weekly if we are aiming to conceive naturally. Likewise, we're aiming for 4 hours or less if we are going to, or we're trying to conceive with IVF. And in both of these cases, we're looking at mild to moderate exercise. And that's really key. We don't want your 5 hours of exercise to be all HIIT workouts. This is really stressful to the body. It's good stress, but your body doesn't necessarily know the difference. So it's going to cause an increased cortisol spikes. We're going to talk about stress a little bit later. But this is going to kind of impact hormones in a negative way. With both of these, we really want you to prioritize core stability, as this is just going to be helpful when you do become pregnant, throughout pregnancy, and then even postpartum to help avoid some of the potential issues that can come with pregnancy and postpartum, like potential prolapse or urinary leakage, things like that. And then you can also start to play around with exercising with your cycle, which I think is really cool. And you kind of do this more intuitively, I think. So with our menstrual bleed, we want to prioritize rest and recovery and even a little bit mobility. So this might look like a little bit of yoga during that time. And again, that's like when we're bleeding, and I like naturally, I don't feel like working out much during that time. So I think if you're listening to your body, you're going to do what's best for you. Then you're going to move through your follicular phase. And this is when we're starting to build some of that estrogen in our body. And again, you can kind of think of estrogen a little bit like testosterone, where it's kind of like the oomph. It gives us a lot of energy. So you're going to start to do a little bit more of like that medium to heavy weight training. What's really cool too about estrogen is that it does actually help us put more muscle on. So you might as well like jump on the train and really like prioritize as much estrogen as you have in your body and do your weight training then to try to put on more muscle. And then as we approach ovulation, again, we're even more increasing our estrogen levels. We're getting that LH surge. We're feeling very energized. So this might be a time where you could incorporate a HIIT workout or two, but continuing to prioritize weight training. And then luteal phase, you can think of as like our kind of nurturing, nourishing. It's more of our kind of like Zen time of our cycle. And this is really a good time to more prioritize like lighter movements, yoga, Pilates, maybe like a little resistance band training. These are all some good options to really start to kind of work within your cycle and see how you can best maintain your energy levels.
Okay, so like Emily mentioned, we're going to talk about stress. If you're feeling stressed right now from all this information, this would be a good time to take a deep breath and let it out. Hopefully, talking about stress does not make you more stressed because if you're here and you're thinking about getting pregnant or you're going through infertility, you're probably already stressed just thinking about all this stuff. I do think it's important, though, to understand the physiological response to stress and how it affects your HPA axis, your hypothalamic pituitary axis. I think it's important to understand because there are things that you can do to help balance the system and it can have an impact. When we talk about balancing it, it's not go on vacation or just relax, stop stressing about things, because that's never good advice for anyone. But these are going to be actionable items that you can do to help balance the system. But I want you to understand the HPA axis, which I mentioned is the system, the neuroendocrine system involving your hypothalamus, pituitary gland, and your adrenal gland. This is the system that, in response to stress, will release different hormones into your blood system to stimulate certain things to occur, particularly to release cortisol. So this is important because when you are trying to conceive and get pregnant, you want to be in a parasympathetic state or a rest and digest state. This is the state where your body is relaxed. It feels like it's well nourished. It has all the resources it needs to survive and to reproduce. What happens with stress, whether that be emotional stress, psychological stress, physical stress, any type of stress really, is that your body is thrown into sympathetic or fight and flight response. And this causes cortisol to release in your body. And it tells your body that you are in survival mode and that it's not safe to reproduce. And so your body really doesn't want to be in that state when it's trying to get ready to get pregnant, telling it's not safe. And something else that happens is something we call the cortisol steal phenomenon. And what happens is during these fight or flight responses, these stressful occasions, the resources that are needed to produce your reproductive hormones like your testosterone and estrogen and progesterone, those resources are used to create cortisol instead. You can kind of see in this graph here that resources from cholesterol essentially are pulled to the side of cortisol and taken away from the side of your reproductive hormones. And we call that the cortisol steal phenomenon because therefore you're producing more and more cortisol when you're stressed and taking away the resources needed to create progesterone and estrogen, which are needed to reproduce. This is obviously important because as we're trying to conceive, we want to support the side of rest and digest and parasympathetic to prepare our bodies for conception. The good news is that there are many things we can do to help with this system and not just quote unquote relax, but actual things we can do. And I'm going to let Emily kind of dive into those things.
So when we're talking about stress reduction, a big thing that we're focused on is that vagus nerve that you see on your screen. And the vagus nerve is really the longest nerve in the autonomic nervous system. And the autonomics are really comprised of that sympathetic and that parasympathetic system. So that fight or flight and then that rest and digest. And so the vagus nerve operates in that area of rest and digest, the parasympathetic system. And it essentially, I mean, it supplies information, or we say innervation, to really everything in the body aside from like the distal third of the colon. So really everything. So if we are improving vagal tone, we can be impacting things like heart rate, we can impact digestion, we can impact our hormones. It's all within the capabilities. So we really want to focus on how do we activate or stimulate vagal tone. And so you're going to see a lot of options here, and there's many more beyond this. I guess a few that I like to kind of mention. So Cardiac coherence is a type of breathing um, pattern or protocol that we teach here. And it does a great job of creating more vagal tone. Chiropractic care is not something that we usually think of as impacting the nervous system. However, that's really what it was designed for, really at the heart of it. Most people think of it for like back and neck pain, which is great. We are happy to help you in those situations too. But honestly, that chiropractic adjustment actually kind of interplays directly with the nervous system and helps to create more vagal tone as well. And then likewise, we have a few different kind of vagus nerve stimulation using devices like the Truvaga. This is something that you use externally on your neck, honestly, for just a few minutes a day to help stimulate the vagus nerve. And then likewise, there are some few little exercises out there that are involving different movements of the eyes. So you can give this a quick Google search and find some videos to learn about the oculocardiac reflex and some exercises to help there. And then as we dive a little further, we want to talk about sleep and how circadian rhythms kind of impact our hormones as well. And this kind of comes in with stress management too. It comes in with how easily our bodies can fall into that like rest and digest state. So we know that increases in melatonin are associated with increases in progesterone, which is a good thing. And then that's associated with improved egg quality. And then again, like we all kind of know the general guidelines for sleep, but I think a few that I think are worth pointing out is really to limit that like caffeine intake, ideally less than 200 milligrams daily consumed before noon. Any amount of caffeine consumed at any point throughout the day has been shown to disrupt circadian rhythms. So doing it as early as you can in the day and as little as you can in the day is most beneficial. And then likewise, getting some morning light exposure to balance our cortisol levels. So there's a natural kind of rhythm of cortisol that we should see, healthy rhythm throughout the day. And we should see a nice little spike in the morning because that helps wake us up and get us going for the day. And so getting that morning sunlight exposure on our eyes, either directly going outside or with a happy light, or even just getting like as close as you can to a window, can help get those cortisol levels into balance for your day. With all of this, of course, we can always supplement melatonin to help us sleep, and that's an option. But I like to always encourage people that, don't try to out supplement or outsmart or kind of sleep hygiene. Really focus on improving all of those sleep hygiene aspects, and then use melatonin kind of as needed to support you there.
Okay, so we can't get through a conversation about reproductive health without discussing toxins and endocrine disruptors. I think we're all pretty aware that we live in a very toxic world at this point, and there's lots of different toxins out there. But I think there's some very important ones called endocrine disruptors that we need to talk about today and how it affects your reproductive hormones. So your endocrine system, just to clarify, is the glands and organs that make hormones and release them into your blood so they can travel to tissues and organs in the body and cause a particular cellular response. You can kind of see in the graphic down here at this bottom of the slide there, a normal hormone generally would enter a cell, bind to the hormone receptor, and then cause a particular cellular response. When an endocrine disruptor occurs and is entered into the body, it can bind to that hormone receptor and either block, change, or cause dysfunction with that cellular response. And these endocrine disruptors can be things that are both natural in the environment or are human made. And those both can cause dysfunction in our reproductive hormones. Some of the endocrine disruptors that I want to talk to you about today are listed here. This is not an exclusive list, unfortunately, but these are the big ones that I think are important to mention when it comes to your reproductive health. Some of these you might recognize. Bisphenols or BPA are obviously a common one. There's also bisphenol F and S, and those are all things found in plastic. Phthalates are another endocrine disruptor that are found in fragrances as well as found in things like hairspray, nail polish to support those the structure in those products. Parabens are chemical preservatives to help prevent mold and bacteria from growing in your products. PFAS or per and polyfluoroalkyl substances are the non-toxic, or excuse me, the non-stick coating on your cookware. So it's the chemical that's resistant to heat, water, and oil. Pesticides are pretty self-explanatory. Flame retardants, again, pretty self-explanatory, but found on a myriad of things like your carpets, your bedding, possibly your furniture, anything that's a textile could have flame retardant on it, including clothing. And then dioxins are a byproduct of combustion and industrial processes that can be found in a myriad of things in soil and food, but particularly important to women because it can be found in chlorinated menstrual products like your pads and tampons. So those are like the big things that we need to be aware of. But more importantly, what do we do about this kind of stuff? Well, number one, we want to just avoid these things as much as possible. And how do we do that? Well, we avoid fast food, anything that's highly processed like fast food or things in the grocery store that we might purchase that are highly processed often have BPA in them through either their packaging or the way that they're processed. We want to avoid those, especially high fat or oil content products like salad dressings and those types of things that are in plastic containers are more likely to leach BPA out of those containers. So we want to opt for a glass container in those situations if possible. When we're thinking about food and liquid storage, we want to opt for stainless steel or glass. So glass Tupperware, our stainless steel Yetis and Stanleys. Think about when you get takeout, if it does come in a plastic container and you have leftovers, don't store it in that plastic, switch it over to a glass Tupperware instead. We want to avoid that non-stick cookware, so avoid because of those PFAS chemicals. So we want to opt for stainless steel or cast iron cookware. We also want to avoid plastic in the kitchen, especially when it comes to hot items. So like our coffee makers and tea makers, especially like a Keurig. Your hot water goes through lots of hot plastic when you use a Keurig, including like the lovely little K-cups. So avoiding that can limit BPA and phthalates and lots of different stuff. You can opt for like a glass French press or kettle instead. We want to avoid canned foods when possible. A lot of canned foods do have been lined with BPA. There are companies that are moving away from that, but research has shown that they can still find some traces of other bisphenols in those. So we want to avoid this when possible, opt for fresh where you can. One of the big things for women is opting for personal care products and household products, such as like your makeup, your shampoo, your face care stuff that are fragrance free. Phthalates are often hidden in fragrances, even in the list of ingredients. Companies do not have to list phthalate. They can include it in fragrance on the ingredients list because it's considered a trade secret. So you have to assume that there is phthalates in any product that has fragrance in it, unless that company specifically states that it's phthalate free. And that same thing goes for room fragrances, sprays, candles, as well. Kind of like Emily already talked about, we want to opt for organic when possible. And if not able to do that financially, just make sure we're cleaning our produce really well. And then last but not least, we want to opt for fragrance-free and chlorine-free menstrual products, which you can find in the stores. There's a couple different brands that we like. Royale is one of them that is chlorine-free and fragrance-free, so it is out there. A few resources that make all of these changes easier for you is ewg.org/skindeep. They also have an app. So this is the environmental working group that if you use this website or the app, you're able to look up all of your personal care products or household products and see what ingredients are in them. And then they rank them out based off of how toxic they are, what that ingredient is, and why you might want to avoid it. And it can give it a ranking, which makes it really easy. I'm that person in the store, like scanning products by their barcode to see what their rating is, which might look crazy, but it's a really easy tool to use when you're trying to find new products. Credo Beauty is another website you can use that screens all of their personal care products, specifically like makeup and hair stuff, through the EU, the European Union guidelines, which are much stricter than ours. And it's super simple because you can actually purchase products off of that website. And then Think Dirty app is, again, like the environmental working groups app, where you can look up products and also scan them in the store to see what the ingredients of concern might be. Okay, so we know how to avoid these things. If you're sitting there thinking, okay, well, I've been exposed to all these things. Are they in my body? How do I get them out? Don't worry, there are ways to get them out. One of the easiest things to do is exercise. We do detox through respiration and through sweat. And this also helps activate your lymph system to help detox through that way. Nutrition obviously is very important. We want a diet high in fiber and antioxidants to help promote natural detoxification through the liver and through your body. Lymphatic massage, very helpful to activate the lymph tissue. Pair that with castor oil has been proven to improve detoxification even further. The infrared sauna is great for detoxification and it's also great for relaxation. There's different supplements you might consider, glutathione, NAC, different things that are going to help with your natural detoxification process. And then acupuncture and cupping are another great option for you.
So we're going to look here quickly at what a basic prenatal should kind of have in its ingredient list. And you might look at your prenatal label and see many other things listed, and that's great. But these are just the basic items. What you're going to see listed here are the general or the recommended dosage, and then as well as the most kind of bioavailable form of that particular ingredient. So for instance, vitamin A, you're going to see retinol or retinol palmitate. You might also see like a beta carotene or something listed on your prenatal. It's a little less bioavailable, but just to say that you might see some different ingredients listed. And the reason being is that a lot of the more bioavailable ingredients are, number one, more expensive, and number two, sometimes they're bulky. So it's potentially challenging to get this all like really packed into your prenatal vitamin. So do the best that you can with these items. It's worth saying with magnesium, zinc, and iron. With those, the best form or the most bioavailable form that you're going to find is going to be a glycinate or a bisglycinate for those. When looking at some prenatal options, we've got 4 different ones that we kind of like here. And you're going to see orthomolecular, seeking health, pure encapsulations, and full well. It's very interesting that like even with all of these, that there are some limitations with them, or that you're going to have to get some other ingredients outside of what is offered within these. So just keep that in mind. There's pros and cons to all of them, but you can take a look and see kind of what works best for you.
Okay, so the next couple slides are pretty dense, and I'm not going to read every single thing on them, but if they apply to you, I recommend writing down or taking a screenshot of what's on it. They're all different diagnoses of infertility and different supplements that have been shown to help with promoting success with conceiving. So I'll just point out some differences on these different slides. So if you're just in general having difficulty conceiving, we want to go ahead and start with that prenatal, like Emily talked about, but also consider adding ubiquinol, vitamin C, and vitamin E. These help with egg quality and are important antioxidants. If you are someone who has PCOS or irregular ovulation, you still want that prenatal, but you might also consider myo-inositol. About 4 grams per day can be really helpful for someone with insulin resistance or someone struggling with regulating their blood sugar. You might also consider our alpha-lipoic acid and NAC. If you have endometriosis, again, you want that prenatal. You're going to see some of these things are very repetitive, like the ubiquinol, NAC. Specifically with endometriosis, though, I want to point out that you might do DHEA based off of testing if you have low ovarian reserve or AMH, and you might also consider adding melatonin. If you suffered with recurrent miscarriages, again, you see the prenatal ubiquinol, NAC. This is another time where you might consider that myo-inositol because of that insulin resistance or irregular glucose control. And again, maybe that DHEA based off of testing or low ovarian reserve. If you are going through IUI or IVF, you're going to see, again, all these kind of same different things. But here I want to specifically point out NAD. NAD is a substance that's found in all of our cells. It's very important for energy production and cell health. And it has been shown that with age, this declines and is very associated with age-related diseases. And it also has recent data has shown that has been linked to egg quality or diminished egg quality with age. And so research has suggested that taking the oral precursor, which is NR, one of the brand names is called CellGuard that we actually carry here at Palm, can actually help improve your egg quality, especially in individuals with low ovarian reserve going through IVF. So it's one of the things I highly recommend individuals consider if they're doing IUI or IVF.
Lastly, for our journey here, we're going to kind of discuss acupuncture and how this can be helpful for menstrual cycle regularity as well as fertility. And I know we mentioned it briefly when we were talking about detoxification. So acupuncture really works to kind of restore that balance in our energetic systems. And the big kind of energetic systems or meridians that we're focused on are the kidney meridian, the spleen, and the liver. And I'll kind of start kind of just working backwards through these, but the liver meridian is really responsible for moving and cleansing our blood. Same thing kind of in Western medicine, as it's focused on helping us detox and get rid of unwanted hormones or things that we're kind of done with in our body. Um, and cupping can be a really helpful tool, especially if we are coming off birth control, to help to support that natural detoxification process. That's to say, if you are in a cycle where you are trying to conceive, once we've approached that luteal phase, so that second half, so ovulation's occurred, we do want to step away from cupping, especially on the low back, as it does have such a cleansing activity, and we don't necessarily want to cleanse the uterus yet when we're trying to conceive. With the spleen meridian, it's really responsible for building blood. So it helps to create a really healthy endometrial lining. So we're really well focused on the spleen energy. And then finally, the kidney energy is really like the big winner here. And that it houses our Jing energy, which is the energy that we're going to pass on to our children. We want a good, healthy kidney energy when we're trying to conceive and when we're trying to have a good, normal menstrual cycle. And with kidney energy, we're really trying to nourish kidney yin in particular. So our current world really has us living in what's called yang dominance, or you can think about this as like sympathetic dominance, where we are just kind of constantly like overworking, we're overscheduled, we're multitasking, we're busy, we're not resting until we put our head down on the pillow. And that keeps us in this yang state. What we really want to do is nourish yin. And how we do that is honestly just doing less and being more. So that might look like meditating, prayer, enjoying music, reading a book, being in nature, and like better yet, if you can do that barefoot. All of those things are going to really help to nourish that kidney energy. So when we take a look then, TCM just stands for traditional Chinese medicine, and we can look at their kind of diet and activity recommendations. And what I think is just kind of really cool right off the bat is that it very much aligns with what we're thinking in this more kind of like modern Western world, or what we're kind of coming to understand a little bit better in the recent years with like ancestral diets and things like that. So with Chinese medicine, we like to keep things super, super simple. We like to just color code stuff. So kidney is going to be color coded black, spleen is going to be orange or yellow, liver is going to be green. So if we focus on foods that are in those like color schemes, we're going to be nourishing those given meridians. So for kidney, looking at things like kidney bean, black sesame, chia, walnut, seaweed, those are all very nourishing for the kidney energy. Likewise with slow cooked meats or fatty seafood. And then interestingly, there's this kind of concept of consuming the product from the animal that you're trying to nourish in your own body. So for women, that's eggs. So we want to be consuming like chicken eggs, goose eggs, and as well as salmon roe are all really helpful for nourishing kidney energy and helping to build healthy eggs. With the spleen, it very much wants to avoid anything that's cold or raw foods like salads or smoothies. So sticking with things that are warm and cooked, and then likewise staying within that color scheme. So squash, pumpkin, yam, grass-fed beef, warm water, even sips of tea throughout the day are really great and nourishing to spleen. And then with the liver energy, we're really focused on, again, things that are green. So bitter greens, beets, and the beet greens you can think of, and as well as cruciferous vegetables. So your Brussels sprouts, your broccoli, your cauliflower are all really helpful for liver energy, as well as olive oil and turmeric. And then likewise, when we're thinking about activity levels, same recommendation really applies, is that we're looking at like mild to moderate exercise to just promote movement of blood and energy or blood and chi. We want to avoid stagnation or sedentary kind of life. And this can be things like Tai Chi, Qigong, yoga, Pilates, things that just keep our blood moving. Walks even can be very simple ways to do this. And then there's this kind of beautiful concept in Chinese medicine where we talk about the uterus as like the baby room, which I kind of really love. It's very poetic. And we want to do things that create like a nice, warm, kind of cozy environment for baby. And you can kind of think of that as like we want to avoid something that's like super hot, like there's a fire, like it's too warm to be in. So avoiding foods that create inflammation. So things like refined sugars, refined flours, avoiding like exercises like again like those like, repetitive hit workouts that really put our bodies into kind of that like alarm mode, that stress mode, create kind of more of a an unfit or not a very nice environment for a potential baby. And then likewise on the flip side of that, we don't want to eat foods that are overly cooling or create kind of like a cold, like damp, like moist environment because that's also not very inviting. Um, so again, staying away from things that are like raw or uncooked foods or even very cold foods temperature wise. And avoiding, we want to keep some level of activity to keep blood flow going to that area. So finding something in the middle is perfect to really create like that good, healthy kind of baby room. And then lastly, the last couple of slides here, we do understand that our discussion has been really primarily focused on the female reproductive cycle. We know that male infertility accounts for a third of our infertility cases. So while we didn't touch on it, we can just say very confidently that anything you're doing for your own kind of female reproductive cycle, for your own fertility, will benefit male fertility. So sticking with all the diet, exercise, sleep, stress management recommendations that we've given can definitely be applied to your male counterpart. And then lastly, we like to leave you with some resources for some books that you can check out if you want to take a deep dive into any more of these topics. Likewise, we are always here as resources for you. We thank you for your time today and meeting with us and attending this webinar to learn more about your fertility. And we do truly hope that you feel empowered to make some lifestyle changes and decisions to best support your road to conception.
Thank you, everyone.